Hello, I'm Dr. Nicholas Jones, Nip and Tuck Plastic Surgery. We are back with another YouTube episode, and today we're going to discuss 4 questions you should ask your plastic surgeon. So basically, you have selected your plastic surgeon, you've done your research, and this is the guy that I want to go in and have an evaluation with. And now you're here in the office, they've given you the sparkling water and they've laid out the red carpet. Now it's your turn to find out about your plastic surgeon. So you're in the room and they're talking to you. Your surgeon finally comes in and you meet him or her. First and foremost, you have a procedure that you're interested in. You want to know what their qualifications are to do the procedure that you want. So what does that mean? How many times have you done this procedure? And are you confident that you can get me the result that I want? And this is very important because experience is key. So the more you do something, just like any other field or industry, the better you are and the more likely you're to have a great outcome. And even with myself, I can honestly say, when I was a resident or when I, started practicing plastic surgery, my results now are more refined. And that's skill and just experience and, observing your work and making appropriate changes. So you really want to know that that's a really important question to ask, and it's really important to see their results, but you want to know if they're qualified and confident to get you the results that you desire. So number 2, this second question you want to know is, where's my procedure going to be done? Where am I going to have my operation? Why is that important? Because you want to know that your safety is ensured. You want to know who's in a room and what they're doing. It's very different from having a procedure in the office as opposed to having it in an operating room. In an operating room, there's an anesthesia provider, a circulating nurse, a surgical technician. In the office is typically your surgeon and maybe a nurse or a medical assistant. It's very different scenarios. And the reason it's important is because monitoring is very different. Like if you're having a invasive procedure, like abdominoplasty or a breast lift, you need to know who's going to be taking care of you and where it's being done. All right, number 3, what are the risks? What are the potential complications? Why is that important? Because you want to make an informed decision. Like, I am not going to go jump in a pool full of alligators without knowing that there's a whole bunch of alligators. So you need to know the risks. I think that was a bad analogy, but hey, I tried. So you need to know the risks. So you have surgery, you need to know what to expect. You need to know exactly what you're signing up for. For every surgery, there are inherent risks, and anytime you undergo anesthesia, there are anesthesia-associated risks. Common example, abdominoplasty. Typically any surgery, infection, bleeding, scarring can occur. But some more complications that are exclusive to abdominoplasty are DVTs, or deep vein thrombosis. So what is a deep vein thrombosis? Basically, it's a clot that develops in the large veins of your body, typically in your femoral veins. And so what happens is when you have an abdominoplasty, we tighten up the abdominal wall musculature, which increases the intra-abdominal pressure, which can slow the venous return from your large veins or your vena cava. So you think about that, and along with having surgery, which slows down the blood flow, and you're in a stagnant position because you're having surgery, there is an increased risk. Even though it's minimal, it is an increased risk. And so you take that increased risk, and you may have a patient that's at a higher risk patients or patients over the age of 40. If you've had a history of any type of malignancy, if you had a clot in the past, if you have some sort of clotting abnormality, all of these things put you at a higher risk. I, as a plastic surgeon, I try to explain these things to a patient, and then we do certain things to try to mitigate those risks. In this specific example, we use compression socks. We give chemo prophylaxis, which is medications to help prevent the DVTs. Early ambulation, which means that you walk, move around early to improve your circulation. And obviously, when I'm assessing a patient, we're getting an accurate and up-to-date history so that we can make a more informed decision. All right, number 4, we got them foes up. Number 4, so what is the downtime? How long will it take for me to recover? Why do you need to know this? Because you got other stuff to do. I don't know, you may have some kids at home, you may have a husband, a wife, side girlfriend, a side guy. You may have a business that you're trying to run. You know, everybody has other things that they have to do. So you really need to know what to expect. Like, I don't want you to have a mommy makeover, get your breasts done, get your tummy tucked with the lipo, and think that, you know, in 3 days you going on vacation. No, it doesn't work like that. So you need to know how long you're gonna be out so that you can have the right people to take care of you, because you cannot go home immediately after surgery by yourself, or you cannot expect to call an Uber driver to bring you home after you've been under general anesthesia, because the last thing that I want is to get a call saying, hey, I can't get out of the bed, I don't have anybody here to help me. We don't want that. So know what to expect. Know how long you're gonna need to recover. What do you need to do to optimize your recovery? Do I need to wear a garment? Do I need to take this pain medication? Just anticipation. So you need to know what to do if this happens, and you need to have a better idea of what a smooth recovery looks like. So in the event that you are having problems, you know when to call your plastic surgeon. Yeah, so talk to your plastic surgeon. Learn from him or her. Get comfortable. Like, when you walk out of that plastic surgery office and before you make your deposit, you need to feel comfortable with your plastic surgeon. If you don't feel comfortable, then go see some other doctors. Go just do some more consults, or maybe plastic surgery isn't for you, because the last thing that you want is to have a surgery and not get the result that you wanted, because now you're unhappy, and as an unhappy patient, you're gonna have to go back and see your plastic surgeon, and they're gonna be unhappy too. So y'all just gonna have like a terrible marriage that's gonna end in an early divorce. Those are the 4 questions you should ask your plastic surgeon. So if you have any other questions or any topics that you want to hear about, subscribe to my channel, and then just put in some comments below. We love to hear your feedback so that we can kind of curtail this channel to help you out in the best way possible.